At first, I would like to go to the next slide. And let's please. Can you hear me? Okay, thank you.
Yes,
I would like to let you know first about the main right of working in Thailand to against COVID-19. As Dr. Anupong says, there is a Center for COVID Situation Administration, which the Prime Minister is the President, and all ministry are the committee here. They have a daily meeting every day, especially in the previous 4 to 5 months. But at the Ministry of Public Health, we set the EOC in this level. However, the permanent secretary of MOPS is the president here, as well as the Operation Center for COVID-19. The secretary, the permanent secretary is also the president here, with not only the member from MOPS, but all ministry send the representative to working here together. This is the national level, and every day they have a meeting and they gather some very important message to convey to the CCSA at the national level. So before the government announcement and announcer, the government announcer, or the spokespersons will release, they will be approved by CSSA at the national level. And if you take a look at the bottom of the slide, in the provincial level, they also have the structure or the body like the national level, and they have to give information, the news, the thing as the national level have done. Please go to the next slide. I would like to go deep down for the EOC. How EOC that we have to work not only in the Ministry of Public Health, in the provincial health office, or even in the district health office, in the community hospital, in the center hospital, everywhere they set the EOC, not only for COVID-19, but for all the things that emergence, like a disaster like this, or the other disease, the outbreak disease. So the way that they have to do this will link to the risk communication. They will have to manage staff. Sorry, it's a little bit typing. Staff and the system. The way that they manage this, they manage by management by the objective to communicate, to control, to command, or to coordinate for, as you have known that from epidemiology, 2P to R, to prevent, to prepare, to respond, and to recovery. However, the one thing that's very important is the communication. Not only risk communication, but here we will focus on risk communication. The thing that Dr. Anupong have presented before, you know, that fake rumor, but something, even the truth, it is a positive or negative truth that will affect the population, the people in your country. So you have to aware this, and then only one spokesperson, only one announcement from the government will come to let you know about the something what is going on in this world, in our country, or even in the community. For example, for the the untruth or fake, or I don't know, but if you wearing a mask for a long time, you may get dead. So they have to inform the people, the community, the organization, how to wearing the mask, or even how to remove the mask when you have to exercise. How can you do that safely? This is for example. And after that, after the spokesperson release to the press or to the TV, to the Facebook, or to online newspaper, many channel that they release for them. This one is very important point. If you cannot coordinate all stakeholders that will help you to inform the people, to communicate the people appropriately. Because when we convey this to individual, to family, to community, to organizations, to public, this will influence the behavior. For their behavior, their both risk behavior or protective behavior. What would you like to see? For sure, we would like to see protective behavior. For example, if you want to reopen your city, how can you inform the people who work in the barber shop to have the protective behavior for themselves and for their customer? We have to go in the detail, not only the standard that each department in Ministry of Public Health release for the every community hospital, every district health office, but we have to inform the people also to make sure that if you go to the barber, if you go to the mall, if you go to the restaurant, you will be safe when you have the daily activity. We have to do that not only to prevent the disease, but we have to protect people, protect our business also. That's all that I would like to inform first, Thailand.
Yes. So thank you very much, Dr. Savitri, for your, I think your overview in terms of the international level and then into the national level and then on through the local level. But however, we have some specific questions regarding to this communication. We know that we learned that when speaking a person and online, both TV and Facebook and Line, that is on for our communication. But however, we have some of the notice that how we can work this information go through the village health volunteer that can get the same message and through this system. Can you elaborate more for information? Since time she will have time 8 minutes left. Yeah.
Yes. So please go back for the first slide then. Yeah, here. As you have seen that, here is we have the EOC as the district health office, and district health office, they are in charge of the primary care unit, which are very close to the community. So they have to work together, not only the health personnel, but also the worker from the Ministry of Interior also in the community. They work together. This is the first thing. So the village health volunteer, they will get the message, they will be trained. No, they were trained, not will be trained. They were trained already about the COVID-19. How will they inform the people? How do they take care the patient? How to protect themselves from the when they go to visit the patient or the people in their community? how can they protect themselves, how can prevent the infection. This is the first thing, they have to be safe. The second thing, how can they convey the message, the important message that make the patient, make their relative, or make the community member prevent themselves from the COVID-19, or even some patients in the community faced with the problem of the stigmatization in community. Village health volunteer have the role in this a lot to reduce the stigmatization. They convey the information, the right one, to the people in their community. And a little bit more, I would like to present that village health volunteer in Thailand not only take care the patients, they also find the risk and trace the risk group until the finish for I think around the 14th day, and they give the inform like how can you live with your family member, or you need to something when you quarantine, I can help you to coordinate with the other people in the community, send you for every meal like this. If someone they don't have a relative, they support a lot.
Okay. Thank you very much, Dr. Savitri. So we have just only 2 minutes for conclusion. So the RCCE is we rely on trust, transparency, and timely. And also we have national level to work, and we have one daily basis behind the scene for all of the information and hard working behind before we present on the message to the public. And also we get the same message from the national level until to the village volunteer. That is my conclusion today. Thank you very much, Dr. Savitri.
Thank you.
This session to Ajahn Thomsak or Ajahn Lek. Thank you very much.
Thank you.